kind of the agenda there. The first of all, I'll kind of start with going over just those new proposed services, which are replacing the day habilitation services, also known as day supports right now on the IDD waiver. Megan Shepard will be kind of running through the transition to a new rate methodology as it pertains to the MFEI or Medicaid Functional Eligibility Instrument level of care tool that we are also transitioning to. And then I'm going to be talking about some of those grant opportunities for our waiver providers in order to support them to move to some new delivery models. And then finally, we'll be hitting on some of the implementation status and feedback before we move into questions. So we've got kind of a packed agenda, and I know that there are going to be a lot of questions, so we'll get right into it. So kind of high level overview, these are the proposed services that we are looking at implementing right now. The first one, and I'm going to go through each one of these in a little bit more detail, but right now we're looking at a retirement and seniors day habilitation service, a community-based day habilitation service, pre-vocational services, life skill services, career exploration and planning, individualized employment services, and then a benefit planning service as well. Starting with the very first one, retirement and seniors day habilitation service. Um, the definition, or the proposed definition right now is that this would be a support services for retired seniors who designed to enhance the quality of their life for older adults by providing a structured, meaningful activities that promote social engagement, community integration. Services aim to support seniors in maintaining their independence and well-being while offering opportunities for personal enrichment. These services may also be used to provide supported retirement activities, which may involve altering schedules to allow for more rest time during the day, and supporting participation in hobbies and other senior-related activities in their community. The service should offer a diverse range of regularly scheduled activities to promote a sense of accomplishment, personal reward, and contribution. These enriching experiences focus really on enhancing adaptive capabilities, productivity, independence, and community engagement. So really targeting those um, seniors on the IDD waiver, older participants, 55 years old or older to be eligible for this service. The units you can see are at 460 for the month, which comes out to 100 approximate for the week and 32 on the day. So, there would be, currently in our existing day support definition, we do have some exceptions that apply. So we'd be looking at the same thing for individuals with potential complex needs or support needs, regardless of age. Really hitting back to that kind of that person-centered plan. Um, so over on the right-hand side, the key components really focusing on those community engagement, social connections, health and wellness, and transportation. Transportation is built into um, the service component, and it's really about uh, transportation to and from activities while an individual may be receiving the service. And then the bottom right-hand side of the screen, you can kind of see some of the other key components, both allowing it to be virtual, community-based, facility-based, not requiring it to be time limited or have an APSE or ACRE certification to it, can be provided on an individualized basis, group basis, and just indicating that the rate has not yet been determined for any of these services right now. Next one, community-based day habilitation. This is probably the one that most closely resembles day support services, as the definition is now. So community-based day support services, this is really about empowering individuals to live fulfilling and inclusive lives within their communities. I know we've got a lot of providers who do things like day services without walls. It's really about kind of leveraging those types of delivery models. Um, really wanting to kind of find those personalized supports that offer those opportunities for growth, connection, independence. Community-based day support services can be delivered in just a variety of settings, anywhere that people maybe live and spend time within the communities. It could be specialized programs emphasizing integration and inclusion. The aim is really to create a vibrant and fulfilling life experience for each participant who's receiving this service. Those activities would be appropriate for leading a lifestyle that kind of, again, all of this is going to be driven by that person-centered plan. Community-based day support is provided, like I said, in a variety of community settings, except in cases where a participant is deemed frail or fragile by their physician, advanced registered nurse, or physician's assistant, and improved. So again, there's some of that exception criteria built in there. Really, the intent is to try to keep this out and about in the community, but we imagine there could be instances in which services may be provided in a participant's home. But again, it's got to be aligned with that person-centered plan. Some of those key requirements. One of the things, same way with our current day support service right now, there's that local education authority piece, where if the school Medicaid funds can't be supplanting what the school is supposed to provide. For adults, community-based day support for adults is available to individuals those age 18 and older. And then the units is exactly the same as the previous retirement-based day service. Key components of this service really, again, focused on community engagement, skill development, those social connections, and transportation, again, to and from those activities while folks are kind of out and about within the community. And then you can see the on the bottom right-hand side, we would be allowed to provide this service in a virtual format, and again, out and about in the community. But this a facility-based is not something that kind of meets the intent of the service. Um, and no time limit or that APSI or ACRE certification. Individualized is okay, groups okay, and again, no rate yet for this service. Pre-vocational services is the next one. Now we're kind of getting into some of those employment-based ones. Here the definition is those services that expand some of those habilitation services under the provision of the 1915C regulation there in accordance with other federal laws. It's really about furthering those habilitation goals, which would lead to more significant opportunities for competitive and integrated employment and career advancement at or above minimum wage. So pre-voc services are intended to enable individuals to acquire, improve, retain, or maintain and prevent deterioration in their habilitation and employable skills. All of those skills learned under this service should be transferable to competitive and integrated employment opportunities. We really want these types of services to empower individuals to develop the skills and confidence needed to achieve those employment goals. So participation in this service is not necessarily a prerequisite for individual supported employment services provided under the waiver. And again, that's a common theme, but it goes back to that person-centered plan. So folks should have a clearly defined employment goal within that plan before kind of undertaking this service. Key requirements. Again, I'm not going to run through all of this. It's mirrored in those previous services. The distinction here is that this one would have a time limit to a maximum of 6 consecutive months of use, with no more than two occurrences within a 2-year period. Shifting over to those key components, this is really focusing on those work-related skills, the work habits, things like developing those common work behaviors, attendance, punctuality, teamwork, independent living skills, volunteering, and then transportation again to and from those activities. You can see kind of the check boxes down there, whereas this one could be provided kind of in a variety of settings, both community or facility based, and there's no kind of supported employment APSE or ACRE certification required there. Moving on to life skill services, I think this is probably another one that looks fairly similar to how a lot of folks currently receive their day support services. This is really designed to equip individuals, in this instance, particularly young adults with IDD, with those essential abilities necessary for successful independent living. Really kind of developing those practical, social, and emotional skills, including personal development, financial management, independent living skills, vocational readiness, academic preparedness. Um, those types of items that allow folks to maintain and increase those employability skills that are necessary for successful independent living and job retention. Both pre-vocational and life skills services are designed to support individuals with disabilities in achieving their employment goals, but they have distinct areas of focus. Pre-vocational services is primarily focused on developing the specific job skills that can be directly applied in a competitive employment setting. And whereas these life skill services, on the other hand, are focused on developing a broader range of skills that are essential for that independent living and successful employment. So it's whereas Prevoke's much more narrow in the intent, life skills has a little bit more space on the margins, if you will, for tying it back to eventually wanting to kind of all those other things that can support independence and employability skills. These have some of the same key requirements that Prevoke has. However, this one has a 14 years or older component to it. The units are the same. And again, this is also time limited. And goals should be being worked on, but we don't want anything to be exceeded past a maximum of 6 consecutive months, with no more than two occurrences within a 36-month or 3-year period. Tying it back to and the key components, communication, teamwork, problem solving, adaptability, time management, technical skills, professional etiquette, all of those things, like I said earlier, that really help support and bolster a participant's skill development to become a little bit more employable in that domain. A component down there on the right-hand side is, sorry, if you can go back one more, we're just there. Yep, I just wanted to call out the individualized and also group and kind of a 2 to 4 type setting. So a little bit more intimate with the hands-on kind of help with those life skill services. Next, we have career exploration and planning services. This is a person-centered, comprehensive planning and support service that is really about assisting and equipping individuals, particularly those young adults with IDD, in obtaining, maintaining, or advancing competitive employment, self-employment. This is a focused, time-limited service. to help those participants identify career direction, develop a plan for achieving competitive integrated employment at or above the federal minimum wage. By providing information, guidance, and practical skills, this service is really aimed around supporting individuals in understanding their abilities, recognizing personal strengths and skills, exploring career options, which is discovering career paths that align with those interests and goals and preferences for how they want to live their life, developing a career plan. So it could be a customized plan or a kind of a living, breathing document that they want to help achieve those employment objectives, and then acquiring um, those necessary skills for job readiness and employment. The key requirements down there looks pretty similar to what I've already kind of stated on previous ones, so I won't go into that. But the components of this service, again, just to hit this home, it's really about the job searching, the exploration, all of those components that are required for, managing a resume and applying for jobs, the interview prep and support, just figuring out what all is out there when it comes to jobs, and trying to define and understand what it is people want to do when it comes to an employment goal. This one you can see allows for both a virtual community-based, facility-based, and an APSI acre component to this as well, which is the kind of the accreditation for employment related services to really bolster some of the philosophy around how to go about getting individuals with disabilities working towards employment there. Again, can be provided on both an individualized basis, one-to-one, or in a smaller group, up to 2 to 3. And we don't have a time limit or a rate right now. Moving on, individual employment support service. This is not necessarily an unbundled service from the day support definition, because we currently do have a supported employment service already on the IDD waiver. However, there are some slight tweaks to it. The definition, it's about finding those folks who are already kind of in a maybe in a specific job or competitive employable situation, um, and then helping them maintain that community integrated work as much as possible. So it's really about tailoring those ongoing assistance and other items needed to advance or maintain that competitive employment, where the employment specialists are collaborating both with the waiver participant, the employers, to help with the job coaching, the guidance, like troubleshooting any issues that arise, to ensure that the long-term job is successful. Goal is to maximize the potential and enhance the job satisfaction and promote the full integration within the workplace, enabling the participant to develop confidence and skills necessary to thrive in their chosen career path through their person-centered plan. Down in the key requirements, one of the things I'd like to call out here is that certified supported employment provider, and then that the individual would have already been deemed ineligible for vocational rehabilitation services. Those key components are both job retention support, collaboration with the team and the workplace, supervisors, figuring out strategies to be able to maintain that employment, looking at ways we can maximize potential and enhance that job satisfaction and promote the community integration. The competitive integrated employment is a big priority of this service. Meaning it's kind of outside of the home setting, and that it's not in a kind of a facility-based setting. and there are person-centered assessments. So it comes down to the really those individualized assessments that there's not a one size fits all to what makes con successful employment for one person. And then we've got essential skills training and transportation as well included in this. Um, so on some of those other components, we're looking at non-facility based, and again, we wouldn't be time limited, and we would not looking at a group setting right now. The final service we are looking at adding is a benefits planning service. This is really focused on how to understand how employment could impact all those various public benefits that participants often have, such as your SSI, your SSDI, Medicare, Medicaid eligibility, food and nutrition programs, housing assistance, able accounts, all of those benefits that are just so hard to navigate and kind of understand when you turn the dial up on how much you're earning, what does it do to this benefit over here, and then when that one reduces, what does it do to these ones? So all of these interdependencies around the public benefits, this is really about trying to help folks understand that the impact that certain decisions and within their person-centered plan may have on other public benefits that they receive. So this is again the key requirements down there. We're looking at kind of how to standardize some of the benefits planning educational requirements. Like what kind of background and certifications would a benefits planner need to have, and so that's still a little bit of an open question. Um, but we are working on that right now. So those key components of this service are about verifying the benefits, the pass and pass development is both around some of the plans to ensure that whatever action is taken or lane that somebody chooses that they kind of understand the full life cycle of how that could potentially go. And then coordinating those incentives across multiple benefit programs, and then tracking and reporting some of those incomes, for various programs. The service could be offered both virtually and community based, and those are the two settings we're looking at. No time limit, but it would be very on an individualized basis. I think that goes without saying. So that is it for kind of the overview of the services. I'm going to turn it over to Megan now.
Good afternoon. So I'm going to discuss the MFEI IDD and the unbundling of services. As you know, Kansans for years have advocated the removal of the basis assessment, and is currently the tool used for functional eligibility assessment for Kansas and HCBS IDD waiver programs. The basis tool was evaluated in 2015. Key concerns include deficit-based approach, inability to capture the evolving needs of the IDD population, and a misalignment of tiers with support needs. Kansas considered various alternatives and then selected the NRI home care tool with IDD additions and their NRI intellectual disability tool to replace the basis. The policy decision to transition from the basis assessment to the NRI screener from HCBS IDD program requires transitioning from a tiered rate system to a floor rate. Failure to transition to a new rate system will halt the scheduled MFEI implementation. We just want to point out that KDADS plans to sustain the new floor rate methodology from the current day habilitation services to the unbundled service, and eventually to all services that are currently tiered on the IDD waiver. So key changes with that include Based on the implementation of the MFEI starting March 1st, 2025, here are the changes. A tiered rate phase out. Current waiver participants will continue to receive services under their existing tiered rate until June 30th, 2026. After the state, all participants will translate to the calculated floor rate. New participants on the floor rate enrolling in HCBS IDD program after March 1st, 2026 will receive services at the calculated floor rate. Participants will need to be assessed and addressed through person-centered plans, ensuring that services align with individual requirements. To improve this process, KDADS has required the MCOs to implement the NRI and the service planning process starting Q1 of 2025. Complex needs service assessment, changes in support and services needs will be addressed with extraordinary funding methods. And some things to speak to that is we have been engaging with the MCOs and their feedback. Also, looking at the extraordinary funding policy and revising that, looking for stakeholder input currently and how we can streamline that process to help with those rate changes for individuals who have higher needs. So some upcoming milestones to report out. The release of training and certification to CDO assessors has been completed. Waiver amendment public comment, we will have that released next week. Expect to see that in your inbox and we'll send it out through the listserv. HCBS IDD waiver changes to be approved by CMS. We are working with CMS to update that language to include the MFEI as the assessment tool. Application is deployed to CAMUS. That was pending right now. And then our release for MFEI level of care IDD again is scheduled for March 2025. Some deliverables we have here is 365 days. We have the floor rate, no longer have the tier rate, have assessor qualifications met, and computer-based training met on Kansas, that is currently on Kansas Train. So I want to go over some examples of how to better understand this policy with the unbundling and the MFEI. So walk you through some scenarios and put yourself in a participant's shoes. So one scenario we have is John is a new HCBS waiver participant in the IDD waiver program. So John has undergone the MFEI assessment and is determined eligible for the HCBS IDD services. During his service planning meeting, John's initial person-centered service plan is developed based on his needs and preferences. John chooses his desired services from the unbundled options that were presented earlier. John begins receiving services at the calculated floor rate tailored to his individual needs. Whether day service is unbundled or yet to be unbundled. So Sarah is a current participant on a tiered rate. Sarah has been receiving HCBS IDD services for 5 years under the existing tier rate. So Sarah will take the MFEI assessment to confirm her continued eligibility. During her annual service planning meeting occurs after KDADS has unbundled day services. Sarah must choose from the new unbundled options. During service transition, Sarah retains her tiered rate for 2 of the eligible services, retirement and senior day habilitation service or community-based day habilitation service until the date we pointed out earlier, June 30th, 2026. The remaining services will be reimbursed at a floor rate. After that date, all of Sarah's services will be reimbursed at the floor rate set for each of the services. And we have David, who is current participant with complex needs. David requires intensive support and has complex needs that must be attended to during the day service. David's eligibility is confirmed through the MFEI and his complex needs are identified. During the annual service planning meeting, the meeting occurs after KDADS has unbundled day service. David must choose from the new unbundled options. David retains the tiered rate for two of the eligible services, retirement and senior day habilitation service, or community-based day habilitation service, until June 30th, 2026. The remaining services will be reimbursed at the floor rate, with additional funding through extraordinary funding mechanisms to address the complex needs. And we have Emily, a current participant that needs changed. Emily's needs have changed and she wishes to adjust her services. She is on low acuity rate, but needs to move to a higher acuity rate due to changes in her needs. However, KDADS has frozen the tiered rate due to the MFEI implementation. Emily does not need an MFEI because her basis is still valid and is still well within the 365-day assessment window. Emily's current services are reviewed in an ad hoc service planning meeting, and her updated needs are assessed. Emily and her provider are aligned on service changes due to changes in acuity. KDADS has yet to unbundle day services. Emily can select day service if that is what she desires. Emily can get additional services due to changes in her acuity. Any additional costs associated with the changes will be addressed through extraordinary funding.
Megan,
Okay,
I think your audio cut out for just a minute.
which part? Did I cover Emily's needs?
Sorry, it was just the past couple of seconds that you had shared. So I am not sure if that included Emily or not, but we might back up to that.
Okay, I'll just review Emily's current needs. Her current needs have changed and she wants to adjust her services. She's on a low acuity rate, but needs to move to a high acuity rate due to changes in her needs. However, KDADS has frozen the tiers due to the MFEI implementation. Emily does need an MFEI because her basis is still valid and is still well within this 365-day assessment window. Emily's current services are reviewed at an ad hoc service planning meeting, and her updated needs are assessed. Emily and her provider are aligned on service changes due to the changes in acuity. KDADS has yet to unbundle day services. Emily can select day service if that is what she needs. While Emily can get additional services due to changes in her acuity, any additional costs associated with the changes will be addressed through extraordinary funding. I just want to review the KDADS plan for implementation. We plan to engage in key partner engagement, which we have discussed, or a few of you have been engaged, the MCOs, CDDOs. We're currently engaging CMS to ensure the waiver is transitioned effectively and within an appropriate amount of time, working on those waiver and policy changes, and providing HCBS day service provider grants that Seth will talk about. And we want to ensure a phased implementation approach as to not overwhelm so many of you.
Yeah, so just another component to help support this transition. There are a couple different grant programs that are being worked on right now, looking at going live post January. The first one is this HCBS Day Service Provider Grants. We're calling it the KDADS New Day Transformation Grant. The purpose around this is to really support those current existing providers to transform their service array and align with any new unbundled day service definitions. So this isn't about um, requiring all of our existing day support providers to provide all of the current services that we're proposing here. Rather, it's more about looking at it from a perspective of like, well, there very well could be providers who have the bandwidth and the capacity to provide all of these services. There might also be providers who are really wanting to kind of specialize and focus on some of these. And so the idea ultimately is to try to provide a much more robust menu of day service like services for participants to be able to choose from, so they know exactly what it is they're selecting when they make that choice. So that's kind of some background around this first grant. Right now we're eligible entities for something like this would be those providers serving at least 25 individuals receiving HCBS services and are good standing with the MCO and their affiliated CDDOs. So again, we're looking at a January timeline through the year 2025. The second grant program is also focused on again day support providers. Bruce, I think you can go to the next one. And this one is born out of some legislation that passed last year, Senate Bill 15. This one is really focused on assisting those sheltered workshop employers who hold a current 214 certificate, which is that Department of Labor certificate that allows providers to pay kind of that sub minimum wage piece. And this legislation is both about transforming some of those models, those 14C models, while also supporting the employees to be paid at least that minimum wage rate. So the eligible entities here are both private nonprofit, state or local government institution that provides employment opportunities for individuals with IDD or physical disabilities, and who also hold that 14C certificate. So that's a much smaller pool of providers across the state, but they still do currently are providing services to a sizable portion of the IDD community who's receiving day support. So this is also a very key initiative.
So this table just represents our unbundling of day service and our implementation status. As you can see, some of the key milestones, drafting the new service definitions, drafting a policy for KDADS, KDHE, and the MCOs, aligning the definition with KDADS leadership has been complete. We've presented policies. We've presented feedback from PCG, which is our contractor that we're working on the community supports waiver with. We've had a couple key partner meetings with InterHab, KUCDD, KCDD, DRC. Currently engaging in this webinar. We had a webinar earlier this week on key partners, and we look at revising some policy based upon the feedback you all provide today by November 20th. We hope to align the new service definitions with CMS also by November 20th or around that time. And finally, finalizing the new waiver service floor rate by December 31st. We hope to kick off the Unbundling Day Services project around January 6th. Currently, some risks and issues we want to point out. Unbundling services may require additional administrative tasks, such as an increased service authorization request. Providers have had issues with MCOs regarding service authorization. We're currently engaging with the MCOs. We've had several meetings with them to discuss these issues related to service authority. Issues are currently being addressed with leadership and the MCOs. Another issue we're working on resolving is the proposed new service may not accurately address the needs of individuals with complex or intensive supports. KDADS will add exceptions to retirement and senior day services to accommodate individuals with medical complexities. Something we're tracking for low risk is the lack of expectation in the proposed new waiver services. Exceptions, excuse me, and the proposed new waiver services may hinder coverage for individuals with unique circumstances. We understand that concern, and KDADS has carried over day service exceptions to some of the proposed new services, as Seth pointed out earlier. Additional exceptions may be considered in the future. A grandfathering rule may be necessary to avoid disruptions for individuals who have been receiving certain services for an extended period. Again, KDADS is taking a phased implementation approach where participants transition at their next service planning meeting. Hence, while some participants may transition early, others might wait for approximately a year after the new services are in effect. Career exploration and planning services may not be readily available in both community-based settings. KDADS has expanded the definition of the service to be eligible in community-based and facility-based settings, while also enabling it to be provided to small groups. Funding for ASPE and ACRE, as we are relying on those grant funds to be able to provide that funding for ASPE and ACRE. Instances where participants completed a service planning meeting right before the implementation date. KDADS is tracking that, and the service planning meeting is expected to plan to transition to the new service as part of the service planning meeting if the next service planning meeting falls on the date post-implementation of this policy. And we will now take questions, and if we are unable to answer your questions during the remainder of this call, please reach out to that HCBS inbox. I'm also going to post the new IDD modernization page that we have developed to address some of your ongoing concerns, and probably where we will post this webinar, and also any, we're developing some FAQs to help you with some of your questions. And, just want to be able for you to stay informed through that website. And I will turn it over to you, Carrie, to facilitate questions.
Great, thank you so much. And I did see there's a question in the chat about answering your questions. So we have a lot of questions already in the chat. So we appreciate those, and we're going to answer as many of them as we can in the 30 or so minutes that we have. Any questions that we don't get to today, we will save down from the chat and work so that KDADS can answer them later on if needed. So we'll do our best. And because we're going to do our best, I'm going to stop talking and invite Zane to start reading our chat questions.
All right. The first question on this list is, for life skill services, how would the local education authority be applied? And if this is day services, how can they participate in this while in school?
Yeah, I I don't know that it would be while they're at school. It's really about figuring out what overlaps and what doesn't overlap. I think in our minds there would be some situations in which the school might be very responsible for providing those types of services, but I can see some situations in which it's not duplicative. But the bottom line is that the IDD waiver can't fund services during the school hours or for services that are part of the student's actual educational program, but it could be accessed if more supplemental and provided, kind of outside of those school hours and address those needs not covered by the IEP. Um, yeah, there's probably more to kind of flesh out on that piece.
Are the rates to be at least the same as what a tier one rate is currently, if not higher?
No, we don't have any information on the rates at this time.
Do we know if the way we do a service plan will change? Will it still be IDD day, or will we have to put one of the other services that the member is participating in?
So can you repeat that question,
Do we
Sam?
know? Yeah. Do we know if the way we do a service plan will change? Will it still be IDD day, or will we have to put one of the other services that the member is participating in?
Yeah, that we're trying to kind of address that with the various hypothetical kind of members, and we'll kind of take some of that back and spell out how some of that process may work with the implementation, because there is going to be a bit of a transition between, when the person's we're going to have a subset of folks who've had their service plan prior to the unbundling, and then the unbundling, it goes live, and then, how does that kind of flow through happen? But we will address that in further guidance.
Right. This next question is, will all day service providers be required to provide all the different models of day services? Is the hope for consumers to flow from one employment model to another?
No, the goal is not that all current day support providers um, are offering all of these. I think I said earlier that may very well be the case for a good chunk of providers who feel that they can um, currently do this, but we're not looking for people to just overlay and try to figure out how to continue doing what they're doing, but just bill in a totally new way. We're looking at really wanting to um, kind of reform the way some of these services are provided by teasing apart these services and better defining what the scope of them are. Participants on the waiver will know precisely what it is they're choosing when they choose the service, and kind of have that conversation with the provider on fit and whatnot.
Can the rates be put out any earlier? That way providers can see what the changes to their budget might be and to plan accordingly, since not all providers function on a state calendar year.
Yeah, we want to get that rate information out to you as soon as we can. There are, uh, some dependencies on the back end that we're working through. So as soon as we can get information on the rate, we will be publishing that.
Doesn't CMS say that there can be no limits on monthly units for IES?
I don't know if they do say that or not. We'll have to take that one back. I imagine there are going to be a handful of questions in here that we're not going to be able to speak to right now. Obviously, I think we've already hit on some of those, but we will kind of compile an FAQ to hopefully to speak to some of these.
Will individuals be able to have the retirement services as well as employment part-time?
Yeah, I'm not seeing a conflict with that right now.
Will consumers need to go through the choice process for each different day service? And what about moving from one with a time limit to another?
Yeah, so I mean, they will, like in any other service, have to affirmatively choose the service and the provider. Um, and they'll still have to go through the current options counseling process through the CDDO. But again, this is really going to be driven by their person-centered plan. So some of this stuff is difficult to answer because that's really the ultimate goal is how can we make these services designed in such a way that allow for more control over what a person is choosing, and know precisely what it is they're getting out of that. And it has to kind of really be driven by that plan.
Targeted case managers already supply a lot of what was listed in the benefits planning description. Will unbundling affect TCM services?
Yeah, we know there's a lot of work that TCMs do outside of what is technically billable. Um, but the short answer is that this shouldn't impact target case management, about what those core definitions that a TCM is able to bill for.
Let's say a 45-year-old has been in day services and would like to become employed. Would they have to begin with voc rehab, or could they jump into one of the employment models?
Yeah, I mean, I know we recognize that there are going to be a lot of these edge cases. But again, I'd like to emphasize the goal here is not to be overly rigid with these. Uh, so I could see a scenario in which that if somebody's securing employment on their own without going through VR, that it's the situation is a little bit different. Um, so I think in that scenario, it'd be key for the support team to be able to document the circumstances of how the job was obtained and outline why those supported employment funding is necessary for that continued support outside of what VR would have been providing.
Is it correct that a person is still required to start with VR and be determined not eligible for IES? And then what if they get a job without VR?
Yeah, same kind of answer. Again, it goes back to what you're documenting, how the job was kind of obtained outside of the VR process. I don't want to give a hard, answer, but they should be somewhat adaptable to the needs of the person. And so some of those individualized questions, we want to be able to ensure that they can, the services can kind of map onto what that person's plan is and what those preferences and goals for what their life, what their good life is supposed to look like.
Was there a study about how other states provide day services, or was there some sort of consumer satisfaction study done? What were the decisions behind rolling this out, especially before having a service-based rate to accompany them?
Um, you know, one component of this is that CMS has been telling us for years that our current day support definition is much too broad, that it's the content of the service is not very clear on what's actually being provided. Um, but then the other kind of the flip side of this coin is that, I keep hammering the point on the person-centeredness of people needing to really understand what the services they're signing up for. Um, that's kind of where the genesis of much of this comes from, is really trying to move the structure of these services in a much more adaptable, person-centered manner, and give a clear line of sight for what they're receiving, both from a kind of a federal perspective on understanding what we're paying for um, with these Medicaid funds, and then just from we feel this is a kind of the right thing to do in moving the needle towards a person-centered system. One other component I would like to add is that we are doing a rate study in 2025. So more information will be coming down from that to hopefully get a much better picture about what what the true costs are for providing the services from a provider's standpoint, and then looking at it from a holistic, overall need perspective from the participants' point of view, so we can kind of match between the two on making sure that rates are adequately supporting providers and making sure that they can provide that service.
You talk about an action, oh, sorry, when you talk about an application is going to be deployed to KMIS, what's the application and what does this mean?
I'll probably let Brutus take that one.
Yes, thank you very much, Seth. So that is specific to the MFEI IDD application that is currently housed on KMIS. So our CDDO assessors would have to log into KMIS to be able to use the MFEI IDD tool to conduct functional eligibility assessment. Thank you.
What is floor rate?
In a managed care environment, the state only ever sets the floor rate, meaning that the MCO can't reimburse below that floor rate, and in fact, they actually have the flexibility to pay above that rate. The MCOs are also tasked in their contract with maintaining adequate provider networks, which means that that they've got the flexibility to pay rates above the floor to ensure that their provider networks are sufficient and the needs of their members are met.
Could these different employment services replace VR? Would someone be able to receive the new IES after going through the Prevoke and the career EXP programs without having to go through VR?
Again, I'm going to go back to the person-centered plan. I don't think that there'd be a strict prohibition on something like that. But now we're getting into some real kind of individualized hypotheticals. But yeah, I don't think we're saying that it, on some of these edge cases that there'd be a strict no, but we will definitely document some of these and get some further guidance out there.
Will credentialing at KMAP be prepared for providers to credential with these changes when this begins?
Yeah, that'll be done before we go live with these services.
Will this look on a person-centered service plan if they choose a different service than the one on the actual service plan for that particular day of the week?
That's a good question. I don't know exactly how it will look, but again, we're wanting to ensure flexibility, but we have to balance that with the accountability and the consistency and the care that is provided. So, but all of these are driven by that person-centered plan. So there are probably some things that can be worked through as far as notating kind of the individual's preferences and flexibility within the plan. I know there are some concerns there around reissuing authorization. So there's going to be discussion there around with the MCO involvement. So I just think that's a very good question, and I think one that we're going to have to kind of further work through.
The career exploration day service, in one part it claimed there was a time limit in the description, but the table on the bottom right said there's no time limitation. Which is it? Is there a time limitation for career exploration day service?
I'm looking at that now. I don't know. I think we might have to take that one back. I'm not remembering where that discrepancy came from, unless Megan or Brutus is.
Yes, if on career exploration, if there's a time limitation on the table there, then that would be an error. I apologize for that. So we will go ahead and clear that off that table. But in the definition of career exploration, we didn't account for any time limitation on that.
Thanks, Brutus. Does having a successful VR case closure mean deemed ineligible for vocational rehab? I guess, does having a successful VR case closure equal being deemed ineligible for vocational rehab?
That's another good question. I'm not sure I could answer that at this time, but we will document this one.
How will service providers be supported for implementing new services? Are there going to be any incentives or training?
Yeah, that's where some of the grant opportunities come into play. With both of those, we're looking at potentially bringing on some technical assistance for providers to be able to utilize. We've also had by all accounts, a pretty successful employment first pilot um, program through our enhanced FMAT funds. So we know that there can be, we've seen the proof in the pudding for some of these models to be pretty successful.
Is it correct that no day services will be billable if completed within an agency? And where do personal care needs occur?
I I don't know that I'm following the question entirely. I no, I mean, some of these services can be provided in a facility-based setting. Um, so this might be one that we can kind of take back and discuss a little bit more and get some more clarification in a FAQ.
So we can read these on the website you shared recently. Is that correct? That these are public examples?
On the transition examples, yes, those are on the website.
For the hundreds of individuals in pre-vocational services, after 6 months, where do they go?
Yeah, we're still kind of working through some of that, and like I said, the idea isn't that this is overly rigid, but there could be some potential for some like time-based exceptions. We want to be very careful about this. Like the idea isn't that we're just kicking people out on the street to go find a new service model. Um, but we recognize that there are some open-ended questions right now as to people who are in current delivery models and what that looks like through this transition process. And so I don't know that I'll be able to necessarily answer that right now, but that's something that's very top of mind for us as we kind of progress towards implementation. So further discussion to kind of come there, especially with those providers who kind of have those are serving those folks in those types of settings right now.
Is it the correct understanding that enclaves and mobile work sites will no longer be allowed?
That is the current direction and movement, but I mean, none of this is set in stone right now. These are all just proposed service definitions. So this is, really kind of what we're wanting to hear, some of that feedback on the kind of the will of the community on some of these pieces as well. So that's a good question, and one we'll take back and assess some more.
Does KDADS anticipate limits to group sizes in the community, or will large bus activities now be the preferred method of accessing the community?
No, we're not looking at large buses going out to the community. That this a component of this is making sure we're compliant with the final settings rule, which is really geared around ensuring that participants have full and free access to the community, and they're fully integrated within the community. But that does, come with a flip side of that coin on the providers actually providing the service, and there are staffing ratios and things there that need to be carefully considered as to actually provide that service. So again, kind of like my previous answer is I think that's one that we're going to want to have a little bit further discussion about on how the programming can be designed to really support that community integration piece, while also balancing the needs of the provider as well.
Does this policy only affect day services for more than 25 clients? How does this impact or affect limited license providers who have one client?
The policy is for all of the services. I think that the 25 client piece was really just specific to the eligibility on the day support transformation grants.
Why is the life skills service only a max of 6 months?
Yeah, that's another one that we're looking closely at. The intent is that people are actually working towards a goal in their plan, and if they're not progressing towards that goal, then there maybe needs to be a reassessment as to what service that might be better meeting their needs. But that's again something, like I'll say it again, is these aren't necessarily set in stone right now, but we are, wanting to have these types of questions and feedback to kind of really assess what makes sense.
Where is the landing spot for individuals who are doing community-based day services, who won't have supports at home during daytime, but who won't qualify for retirement and senior programs? Are they out and about all day, every day?
No, I don't think that would be the case. But it's a very good question, and I think that's another one that we will absolutely take back and try to speak to and further guidance.
Factor in that the clients don't have additional funds to access places in the community. There are ticket prices and costs for entry that are a barrier for individuals on limited income. Staff will also have to have these costs considered because places don't let them in for free, just because they're there supporting someone.
Yeah, that's a good comment, and I think something that should hopefully be, reflected as we do rate study activities.
IES definition doesn't address what is a billable activity for a provider. Do all staff providing SE support do they require certification?
I believe when we're talking about that APSI and that acre certification, it's based on like the individual worker basis. So it would be that the job coach is the one who is certified. I will have to double check on that, so don't hold me to that response. But I believe that's the case.
How can someone find a job if they're not eligible for VR? The IES option only provides for support on the job.
Can you repeat that one, Zane? Trying to process it.
So if someone's not eligible for VR, the IES is only providing for support on the job. How do they find a job?
Yeah, again, highlighting kind of the flexibility, and I don't know that we would want to be too restrictive in a situation like that, because I'm thinking if they, and Brutus, correct me if I'm wrong, but if they were to find or have a VR case closed, they could potentially access that service, and that service then would absolutely be able to help them find a job. But that might be one where again we'll get further clarity on that.
Some of these new services are time limited. For example, there's one that's 6 months. Does that mean a new service plan is required when that service is completed?
I don't know, Brutus, how are we? Have we kind of thought through that piece yet?
Um, that probably is something for us to take back to make sure we've thought through it and we're able to provide a solid response on that. But definitely a good question.
Yeah, I mean, again, the service plan, usually it's done annually, but it's supposed to be responsive to the waiver participant as their needs change. So, yeah, that again, that's something that we will take back.
For existing day programs, can the day program building be used as a meeting spot in the morning and afternoon for arrival and departure prior to going out into the community? Does this meet the requirement under community-based day support? And what about people that are unable to be in the community for the full 5 hours due to behavior or medical needs?
Mhm. Yeah, I can't don't want not wanting to get into the weeds too much. But yeah, that's something that's been highlighted, I think, previously in some of those other questions about how we kind of address some of those situations where there seems to be kind of a gap between what the content of the service is, and we don't want to create a situation where people are kind of falling through the cracks in that. So yeah, we'll be looking at that too.
Great. Hey, Zane, just a quick FYI for everyone. We've got just a few minutes left, so this will probably need to be our last question. I do want to remind folks that we do have all of the questions recorded, and you can continue to put them in the chat. And that Q&A document will be emailed out and posted on the KDADS website. So we will get you answers to the questions that we've not been able to answer today.
All right, the next question that was on my list for our last question here. What determines someone to be grandfathered in, and how will the state make this determination?
Right now, I mean, the grandfathering is based on when the MFEI goes live, which currently we're expecting that March 1st date. So it would be any individuals who are an existing waiver participant on March 1st and have a tier score, essentially on the last day of February, um, would be grandfathered in through the period of from March 1 through uh, July 1 of 2026. But there's a question about what that looks like if we are unbundling in that time period and there are rates. So there's going to be a lot more information about what that looks like, I think, once we get kind of the rate questions answered for you.
Sorry for that delay. I had to find my unmute button. Right. Well, thank you everyone so much for all of your questions. We appreciate you being here. We appreciate you asking all of these questions so that KDADS can consider all viewpoints and angles from this. Just a quick reminder, if you didn't see it in the chat, we are going to be emailing the link to the Zoom recording, the questions and answers document, and the slides to everybody who registered for this event. So you'll all get that directly into your inbox, as well as those who weren't able to be here but had registered. KDADS is also going to send that out to their listserv. So it will maybe get to you a couple of times, but we'd rather that than it not get to you at all. And those things will also be posted on the KDADS website. You can continue to drop your questions in the chat until we close the room. After that, you can reach out to KDADS. We can drop that those links in the chat one more time for the KDADS project website and email address. So you can save those if you would like. And with that, thank you everyone for your time today and for joining us and asking your questions. We look forward to seeing you again soon.